solution strategies that can be adopted to improve healthcare delivery and ensure that healthcare infrastructure is equipped to meet evolving needs of the patients. So catering to the present and future healthcare infrastructure challenges. And in this panelist, I would like to one by one invite our esteemed speakers. Moving on with our very first speaker, the moderator of the session, Mr. Ahmed Faiyaz, the partner Healthcare and Life Sciences, PwC Middle East. Sir, can we please have you on stage? Big round of applause for Mr. Ahmed. He will be moderating the panel. I would like to invite Mr. Vijay Dhawangale, the founder and chairman of Lifenity International. Can we please have you on the stage, sir? Mr. Bruno de Souza, the Chief Operating Officer, Dubai and Northern Emirates, Burjeel Holdings. Sir, can we please have you on stage? Mr. Emad Thukair, CEO, InterHealth Canada Limited. Welcome, sir. Thank you so much for coming to this Global Healthcare Summit and Awards. We have two more panelists joining in at the last minute from PwC. Dr. Manish Arora, the director of PwC. Can we please have you on stage, Dr. Arora, if you are here? And Dr. Chiranjeev Dwivedi, the Associate Director of PwC. Dr. Chiranjeev, are you around? All right. So in this discussion, as I said, we are going to delve into catering to the present and future healthcare infrastructure challenges. And for this, let's try to wind the session, sir, in 1 hour. Over to Mr. Ahmed Faiyaz. Thank you so much.
Thank you. Thank you. Good afternoon, everyone. And thank you for my panelists who joined me here for a hopefully interesting and engaging discussion on healthcare challenges, opportunities. I think we had a very interesting morning with a very esteemed panel and members from both Saudi Arabia and UAE government who spoke about the changing picture of healthcare in the region, digital evolution, the adoption of technology, and how technology is changing the way healthcare is delivered and planned for the region. But what I'd like to do is get started. Dr. Emad, maybe we start with you. What do you see as the key challenges in the healthcare market, not just in Saudi Arabia, but in the wider region? And how can these challenges be addressed by digital health, by reimbursement, by regulatory support? What is your view on these challenges, and where do you see solutions from different stakeholders? Maybe you can start and we can get other panelists to chime in as well.
Thank you. Thank you very much for having me here, and thank you very much for me starting answering this question in this panel. One of the common ways we used to, as families and citizens, address healthcare when a child has got a flu or when someone has got a cough, we immediately go to the emergency department of a hospital. The concept of primary healthcare was almost non-existing, which is the main gateway and the main door into the hospitals. And with the populations increasing, the overload in so many of the emergency department became so unrealistic and non-sustainable. So one of the things which I believe has been an issue and still is the concept of primary healthcare, which will be the gateway before going into a hospital. It has been, since it has improved substantially, I know in Saudi Arabia there's about 2,500 primary healthcare center plan and expansion. They're putting out a private-public partnership for the first 150 to be operated by the private partner, the relationship with the government. And they're going a little bit a step further. They're allowing now the private sector to have what they call emergency clinics, which are a lot smaller than primary healthcare, maybe around 200 square meters, which are in the different small neighborhoods where it can take care of a lot of the basic requirements, let it be stitching for an injury, and sometimes even it's linked to some home health care to reduce the pressure on the hospitals. I remember when we operated from 1998 as InterHealth Canada to 2003 King Sheikh Khalifa Medical City in Abu Dhabi. The first day in the emergency department, we ended up with about 400 people. And with our culture, the patient will not go alone. Usually it's the father, the mother, the sister, the brother, and so you end up with mind-boggling numbers. And we tried our best to try to put a system there where everybody wanted to be treated as an emergency. And so we had a way where really the outpatient clinic, we called it Emergency 1, because patients don't want to be told, no, you don't need to go to the emergency, you can go to the outpatient clinic. And the real emergency was Emergency 2. So this is one of the big problems, and particularly in Riyadh, with our 2030 plan to increase the population from what we have now, which is circa around 8 million to 15 million. You can imagine whatever we have built as an infrastructure in healthcare for the last several decades, half a century or more, need to be doubled in the coming 8 to 9 years. One other major problem in our culture also in societies, and which reflects on the healthcare, is the length of stay. We have made some detailed analysis and studies about the length of stay in the government hospitals. And there is the possibility with the right softwares and the right IA to substantially reduce this. And you can imagine if you have 10,000 beds in a city and you can reduce 10% of that population, that's 1,000 beds. That's 5 200-bed hospitals, which everybody keep on saying, we're going to build, we're going to build. So I think this is an area also to be looked at. And AI is very, very important in that. There were some softwares that we managed to get from Canada and a few other, which substantially reduce the waiting list that can work for huge hospitals, 500 beds and above. I'll pass it on to my colleague.
Thank you. Thank you, Dr. Emad. Maybe we jump over to you, Bruno. What do you think are some of the biggest challenges? I mean, as a system, you have infrastructure across the UAE, but also in other parts of the GCC, the subcontinent. Tell us a little bit about how you are building future-ready infrastructure that kind of blends in and works with remote monitoring, digital health, and what are some of the technology innovations that you are adopting to address some of these challenges? I think Dr. Emad had some very pertinent points around primary care, role of AI, shifting patients away from emergency care centers. What are your perspectives?
At the offset, just wanted to inform everyone that I've seen this great country grow from leaps and bounds. I came in the year 1997, where insurance was just setting in, very few healthcare providers. And what I have seen now, it is tremendous. What major gaps which I always see when an economy is growing is always to provide quality healthcare, at the same time manage the costs. Problem is if you do not manage the costs, the premium goes high. And as every individual company, they are mostly into profit making. They will cut down on the premium. Eventually, it hurts the employee, and especially chronic medications, long-term care, emergency services. So what I have noticed is all year round is we as private healthcare providers are always in this give and take of how to reduce cost, how to manage newer technologies, how to manage patients' expectations. We always have faced these things, especially in the ER, as Doctor has rightly said. It's all about education. It's all about managing people's expectations so that they don't end in the ER. And here where the technology comes, here where is artificial intelligence comes. Even just the other day I was in a conference where there was artificial intelligence where you could tell about people knowing about a diagnosis much more in advance may it be a stroke, may it be a cardiac arrest, and that is what data does to all of us. So that is one thing, one challenge which we face. The other challenge, as I said about the cost, is being UAE, yes, it is very attractive, but to retain talent, it's a bit of a challenge over here. Talent in terms of trained, competent skills. They always would want to go abroad, they wouldn't want to go to European countries, but COVID has done very well over there, and it is, as Dr. Ravi rightly said, it is the CTO of the new age to come. Healthcare, when it comes to initiatives from the regulatory bodies, especially Dubai and UAE as such in general, I've always felt the bodies are very much in advance. They have the D33, which is coming up. They are very on the innovation and technology. And I have seen it all throughout my life, the 25 years which I spent over here. Healthcare, there is no end to it. Technology has to get into healthcare. Innovation is the way forward. Thank you.
Thank you so much, Bruno. I think those are very, very pertinent observations. And I think you speak from real-world experience of having been here for close to 2 decades. Over to you, Vijay. I mean, what we are seeing is that the pace of change and the adoption of technology is very fast in healthcare. And I think it's only accelerated post COVID-19. How do you see, what do you see are some of the examples of how tech can be leveraged in a manner that's effective? I think what Bruno also spoke about is that there's a lot of downward pressure on cost. There are challenges related to bringing and retaining high caliber clinical resources. So where do you see the greatest opportunity for technology adoption, and how can it fix some of the challenges that we're seeing today?
Thank you for giving me this opportunity. First, I will tell you that in current scenario, UAE is doing whatever the best in the world. They are having as far as the technology point of view, as far as the medical sector, they are doing well. If you see the number, I will just talk something about what are the numbers are. 4.5% of the GDP we are spending on the health sector. Somewhere around 1.5 bed per 1,000 is the current number of beds in the UAE. If you see the nursing staff, if that is also 5.7%, which is almost, I can say, all developed countries, it is equivalent to that. So right now, the challenges what we facing is non-communicable disease related challenges, which is the lifestyle related diseases, which I will say, which is the, first is the diabetes, the one, and second is the cardiovascular is the biggest challenge. 2/3 of the death in UAE is happening because of the cardiovascular. And second is the diabetes. And third is about the oncology, means the cancer. Now the biggest challenge what is coming is because UAE is offering the best of the best infrastructure for living and entertainment. So the migration is happening. Over the next 10 years time, our population is going to increase by almost 20%. To cater that, we need to have an infrastructure. So, but to increase so much of infrastructure, it takes huge capital investment. But what is the alternative for that? Use of the technology. Segregate the difference between the critical care and the day-to-day lifestyle management of the diseases. So for that, the technology is the biggest use for that. Like if you have a proper diagnostics, you can manage your diseases in better way. If early detection is happening, like what we are doing in this sector is, we are started the genomic testing. We all know that genomic testing is one of the things which cannot change over a period of time, like the blood parameters. So once you have a whole genome sequencing of your own, like already UAE is the first country, I can tell you that, which has started the genomic sequencing for their all Emirates. They are the first country to start with that. These type of the advanced thinking is already there with the UAE. So now what is required is that to penetrate that to the masses. and use that technology to educate them and to make that our technology available to them. And mostly we all have seen that we almost all is having our I will say that every company is having their accountant, every company is having their CA, wealth manager, but nobody is having the health manager. Why don't we think on that direction? 80% or 90% of the population or citizens can manage their health sitting at home. We should try to stop the feed towards the hospital. Can we handle that at the home level? Now we have seen that right now 1.1% of our population is above the age of 65. In next 7 years, 4.5% of the population will cross the 65 age. So it means that geriatric care is more important. How we can handle the geriatric care? That can be at the home care only. So more home care solutions we need to provide. This is what I feel is the challenges right now.
Thank you, Vijay. I think you very good observations with numbers on the growing burden of chronic diseases, the rising cause of mortality from the burden of these diseases, and the fact that we are now a more stable and we are a stable aging population in the future, right? So I want to come to Dr. Chiranjeev. What we are also seeing change is regulators are starting to view new approaches to managing health services, and value-based care is being talked about as one of the future models. Now, how do you see value-based care playing a role from a reimbursement perspective? What should this focus on? And how do we implement this? What is key to implementing this? Because the panel has spoken about a lot of challenges. Is this perhaps something that can address challenges that we are seeing today?
Thanks, Ahmed, for this question. I think value-based care is something which is quite a burning topic in this context. And what is more important to understand is that there has to be a shift from volume to a value base. And for that, we need to focus on the outcomes. We need to focus on conserving the cost of the care to the patients. And I think the way it could be done is how the new payment reforms or the reimbursement model can be brought into picture. A perfect example could be something like what in the wake of COVID, the mental health has been the focus, right? But what are the different reimbursement models the mental health program could actually focus so that it could be brought in the mainstream population, and then those could be leveraged upon. And I think that's the very, very important part, given the fact that now we have infrastructure, we are starting to focus on quality. I think now the time is to focus on the value through these payment model reforms and bring it in the mainstream.
Thank you, Dr. CJ. In terms of evolving to value-based care, it needs stronger capabilities on healthcare analytics. It needs better coordination of care across the ecosystem. So where do you see this, Dr. Emad, in terms of your own business? How do you see this evolution, and where do you see the greatest possible impact to your business, and how will you adapt to such models, value-based care models, a lot of technology-led models?
The COVID crisis had the big positive impact of the utilization of technology, AI, in every aspect of life. Let it be a Zoom call from home in place of being in the office, to the delivery of food, and in healthcare, it excelled, and in many, many places around the world, among which Saudi Arabia and the UAE to a large extent. But the analysis of the kind of diseases, what is the best way to look at those diseases and get the prevention of it, there has been, still we are lacking behind in many, many ways with the implementation of our artificial intelligence. We know as a company we're very much into private-public partnerships, and we've got our hospitals we had in the UK, in the Caribbean, we still have for the coming 25 years. In Poland, we just opened our first PPP a couple of years ago, and we just opened our newest in Riyadh. The way we are approaching all the way from the commissioning of those hospitals to the marketing planning, to the disease analysis, to the home health care preparation, and using a lot of the instruments and a lot of the equipments that can have a lot of patients still be at home and get treated, has reduced substantially the pressure on a lot of our hospitals, but also has opened our mind and opened the possibilities of some amazing, tremendous cost savings. The private-public partnership in AI and in information technology has started also where a lot of companies are coming in, investing in the infrastructure on behalf of the government, with the government guaranteeing them a contract over a period of time. And we can see the impact on that in many sectors in Saudi Arabia. We mentioned earlier on some of the diseases like diabetes. It's a way of living. Apps have had such an impact. A lot of people started more and more looking at the way they live, the way they walk, the way they eat, what calories there are. But still, I think we are at the very, very beginning, and we haven't touched the tip of the iceberg. There's so much more to do. There is still resilience from the older generation who are not yet believing in the ability of those gadgets and those apps to really help and treat. But they realized in the scheduling in a hospital, in one company, I don't know that it's here, it's a UAE company, Okidoc, which is for the outpatients, an amazing product where it helps the doctor get the information before the patient gets there. It helps him follow up later on after he's gone. It reduces substantially the visits. Another app regarding booking and how to remind the patient that you need to cancel or you need to book. There are so many things, but unfortunately we're still lagging behind. We have done fantastically well in the region over the last 3 or 4 years, but there is still a great deal to do when it comes to information technology.
Thank you. Thank you so much, Dr. Emad. I think one of the observations has been that how can we make care more accessible and more affordable to patient populations, not just in the country, but in the wider region. And on the other side, you see a number of big organizations commit and deploy capital and set up quite advanced clinical infrastructure in the country. But still there seems to be a disconnect or a problem. I mean, you see so much of advertising in the city that is targeted at healthcare patients or healthcare consumers. You know, I was sitting in a cinema 2 days ago with my kids, and there were 2 ads before the film. Both were from 2 big healthcare providers. So it seems like, and Dr. Fatih was here. He couldn't join the panel. He had to leave. He's a CEO of a leading Dubai hospital. And he was talking about how, you know, you probably have an oversupply in many of the services and their challenges to compete in a market where, you know, there are perceptions of oversupply. So, Bruno, I'll direct this to you and then maybe ask Dr. CJ and Vijay to come in. What do you think is the challenge and how can we address it? On one side, you have so much of investment, deployment of capital, clinical infrastructure. On the other side, you have, you know, either the regulators or from a patient perspective that we don't have access to quality care. How do we fix that?
So if I understand that right, that there is oversupply, but I fear that it is not oversupply. If you ask me, there is a great divide between how we cater to different segments of patients. There is maybe an oversupply for patients which are at the top of the pyramid, and there are a lot of healthcare providers which try to cater to the small segment over there, while the mid and the bottom, there's a huge segment over there which is not being catered to. We as Burjeel Holdings, for that matter, we want to fill up that gap of provision and providing care and make them accessible to the mid and the lower, at the same time at the top. But since at the top there are a lot of providers, so it becomes an oversupply. I think so. I made a point over there. Yeah? Thank you.
I think one of the interesting concepts, or I may say, which can actually address this is how can you bring the payers and the providers together as well? And I think that's the concept which is the important one to understand, which is something called as payer-provider integration, or you can say payvider. And that's something which needs to be highlighted and can be used in this context to ensure that there is an accessibility of care. There is a cost optimization. The providers are dealing with overutilization of the services for which it is not meant to be, and at the same time, the higher rejection from the payers. Now, how can you bring them all together and can have a model wherein payers and providers come together? And to the Bruno's point, wherein the care can be provided to those mid-tier segment wherein it can be accessible and can have those cohorts to specific payers and the specific providers for that matter, wherein you get the care to the patient by using the innovative models like be it a telehealth model or a system. So I think that's something which could be thought through and innovated in this context, which can help a lot in the system as well.
Thank you, Dr. CJ. And I think providers who play in that, let's say the upper tier, more premium segments of the market could potentially use technology, can use digital solutions, home care solutions, and start addressing the patient needs at the affordable or the low income segments, because that's where we see that stark gap, right? There is a serious quality issue there. There is a serious patient access issue in those segments. And maybe a solution is by partnering with payers, you can channel many of those patients, at least for their secondary, tertiary care services, to infrastructure that is, otherwise positioned at the premium end of the market.
At the same time, what I would also, this is where technology comes in, where we have a lot of initiatives where we have created partnership with other suppliers, vendors to have digital kiosks, lot of telemedicine which is going on, mobile clinics, virtual care. So this is one of the areas where digital technology has helped us to make care accessible to a wider population, at the same time give personalized care. Now it is all an age of personalized care, because that does not come into the picture where you tend to cater to mass, but you tend to forget that every individual is different. One shoe does not fit all, size does not fit all. So you have to get into that personalized forum where each individual is also responsible to take care of his health, and we support him through digital technology. Is what I feel the way forward would be: personalized care, more accessible, virtual care, mobile clinics, kiosks, you name it.
Yeah, you are absolutely right, sir. We need to divide the kind of the patients, or I will say the citizens, in that first is about the preventive care is more important. Most of the chunk has to towards the preventive care, which is not there right now. Second is the primary, then moderate, and then critical, which we will call the tertiary. Tertiary care is the best in this country, I can tell you that. The challenge is the primary and the preventive. Primary we can shift to the tele-consultation, because you don't need to have so many clinics. You can handle primary. And the most important thing is the preventive health care. Huge potential is there. If we all think about that, why don't we do my own diagnostics, still I am fit. But I need to know what is my internal parameters. If you go according to that, we know that what is my internal situation is. We have seen this situation in COVID. Every individual was different. COVID-19 was having more impact on some individuals, and it was not having even the single symptoms on the other individual. So now, when we realize that the genomic testing is a key for that, so now it is important that if we all do our whole genome sequencing, not even the whole genome sequencing, at least the wellness panel, to know that what kind of the diseases can come to me based on my genomic. Because this is all now such a huge technology being already there. We have our own solution, artificial intelligence. Through that, we can tell you that this kind of the disease can come to you, which food intolerance we are having. If now I have my kid and I know that if he is having the lactose intolerance, I'm not going to give him a milk. I'm not going to give him the milk product. So over a period of time, his life expectancy, we all know about life expectancy. Our life expectancy in UAE is already being 78 years. But I am always talk about healthy life expectancy instead of the life expectancy. What is the point of living the life 100 years in last 30 years on the bed? Instead of that, how healthy life expectancy is. And that is possible only by prevention, I can tell you that. And that is the key.
Your point, do you see perhaps some evolution or advancement in genomics that can be potentially covered through payers or insurance to make this more affordable to at a population level, right? Because it's key that, see, genome sequencing is something that is accessible today in the country. If somebody can afford it, they can get it done. But how do we make this accessible at a mass level?
Yeah, that's what
and
I'm saying.
How can that play a role in delivering personalized medicine to the point that Bruno made?
Right now it is at the premium cost level. But if we go on the masses, the cost will definitely come down. Whatever the present pricing is there, I can tell you the minimum 3 times we can reduce the cost if you will go into the masses. But for that kind of the awareness needs to be there. I cannot say the government policy, because government policy is already there. They are doing for all Emirates, they are anyway doing the whole genome sequencing. But if this type of the mass level screening is happening, then definitely cost will be so minimum, everybody will want to do it.
Okay. My last question is to you, Dr. Emad. We have ESG, it's at the top of everybody's policy agenda across our GCC countries, but also globally. What are, let's say you've got businesses in different parts of Europe, in Asia, in GCC. What are health systems like yours doing to make, healthcare more sustainable and improving our response to ESG goals and ESG agenda? And I think maybe other panelists can chip in as well.
I've always been a supporter of the PPP concept, the private-public partnerships in healthcare. Unfortunately, in the Middle East and in the MENA region, the PPPs are still infrastructure PPPs. The needs of the government to say, you finance, you design, you build, you equip, and then we will manage and we will operate as a government. In the past, we were doing the same. We were giving it to the private sector to design, to build, to equip. So there isn't much difference in this, which is only 2 years. The real cost efficiency comes in that operation of a period of 20 or 30 years post-construction. Roughly the cost of 1 year operation of a hospital is the cost of 1 year of its building. And in 5 years' time, it doubles and triples almost in 10 years' time. So if someone is going to look at efficiencies, it's very much needed to see how could the private sector get more involved. And I'm not saying here the government civil servant who runs that hospital is not capable to be as efficient as the private, because the government regulations and the box they put that employee in is a lot more stringent than the private. So I'm sure if they go to any of the government hospitals and they turn to the managing director of that hospital and they say, last year we spent 100 million dirham operating this hospital. This year, take the 100 million, do it in the way you feel fit, as long as you're going to make efficiencies or increase the productivity. I'm sure 10, 15% better outcome will be there. We lived it in the UK. We won a project to do joint replacements in the UK by building 2 hospitals, and the government guaranteed us a minimum number of cases. And we won it at what they call tariff, which is government price, plus 8%. Our shock was, when we started operating, we were realizing not 8%, but 33% margin, which was wonderful. But it meant there is a lack of efficiency in the costing of the government of almost 25%. And this is the UK, one of the oldest, most capable governmental healthcare system in the world. The same thing happened in the Caribbean. The first year of operation versus the year before, there was a 42% reduction. So what I'm trying to say, I think it's imperative and very, very important. The government cannot carry on sustaining what you earlier said with the age group. It's increasing from 78 to 80, 82. There will be a lot more elderly. There will be a lot more cases where it needs to be attended to. The government healthcare system won't be able to sustain it. I remember a shocking figure in Ontario, in Canada. The 50% of the cost of healthcare is spent on the last 4 weeks of life. I mean, when you look and say, my God, it's impossible, how could this be? But a lot of us go through life with only a headache and aspirin and so forth, and God forbids at the end you have a heart attack and you need to go to the ICU for a period of 1, 2, or 3 days, and it's equal to multipliers of the cost of all your life put together. So what I'm trying to say here, I hope our governments will start looking at the opportunities of giving the private sector the opportunity really to get involved and in the operation of hospitals, and to try to see how much efficiencies can be brought there.
Final word from you, Bruno. And
Yes, when it comes to sustainability, I feel so. Again, it all depends on the operators and the leadership, how they chart down their journey into making an organization sustainable. As a listed company at Burjeel Holdings, definitely we have to be sustainable. We have to be carbon neutral by 2030, and sustainable use of reuse. All these things are there. But what I want, in fact, is from the leadership, it should trickle down, saying how to be sustainable, how we should, to a simple thing, switching off the lights. I would suggest, since there's a big forum, consolidation is one very important aspect of sustainability. At Burjeel Holdings, we have consolidated 8 departments: procurement, pharmaceuticals, you name it. We have consolidated. It reduces the utilization of resources, brings in efficiencies, and this is what I would want, and it should trickle down from leadership way down to be sustainable. It is not from one man. It is a culture which one has to come to develop ESG and be sustainable. Thank you.
thank you, Bruno.
Yeah, you rightly said, sir. Health and wellness and then the operational sustainabilities are the main pillars on which our company is working. So what sir says is the same thing, that we are consolidating all resources and effective utilization of that and at the cost effective. These are the more important factors compared to in our diagnostic industry. If it is come to the treatment point of view also, I come from the country where the effective utilization of the high level resources are being done. I can give you the 2-3 examples like Narayani hospitals and some of the topmost hospital in Mumbai like Bombay Hospital, or you can say Brishkendi, Lilavati, what they are doing now. If you have a good surgeon, surgeon is doing only surgery now. One cardio surgeon is doing 10 to 15 surgery in a day, because everything is lined up for him and his effective time is utilizing. Because of that, the cost of one cardiovascular surgery in India is 1/10 the cost in, I can say, in US and UK. So that sustainability, that model has to be somewhere being used, so that let the specialists, let the experts handle their expert work, and the rest can be handled by the team.
Thank you, Vijay. What do you think, Dr. CJ? Because what we also see when you implement value-based care, you can cut down a lot of wastage and variations in care, and make it more efficient, and therefore make it more affordable.
Absolutely.
What are your perspectives and observations from what you've seen?
I think value-based care, what it does is it actually pushes an envelope to be more operationally efficient. At the same time, how can you make the care more affordable? So I think what every panelist has said right now is actually true, saying that how can we make our operations more efficient, be it clinical, be it non-clinical? How can you deliver a system in which you can actually utilize less resources and can have a more throughput? I think this is the best time to actually for the healthcare at the cusp of 2023, where the COP conference is happening in the region as well. I think it's the time to take an awakening call for the healthcare system, not only across the world, but in this region as well, wherein the ESG could be something which can be taken as a baton forward and can be worked upon.
Thank you, Dr. CJ. Now I stand between you and lunch. I want to thank you for being a wonderful audience, a very patient audience, to listening to us very observantly and supporting this panel here. I think just to sum up, we spoke about challenges, we also spoke about solutions. I think a lot of solutions have come up with this esteemed panel here, right from shifting focus to primary care, moving patients away from using ER and expensive resources, focusing on that lifestyle management, a shift to preventative care, a shift to more efficient management at the hospital setting, a lot of emphasis then on population health management, virtual care, use of telehealth, home-based remote patient monitoring that can play a critical role, the use of value-based care solutions, payer-provider solutions that can effectively support reimbursement for care that is more affordable and more value-based. I think across these regions and countries, we've seen so much of great investment, focus of the regulators to improve and enhance the quality of care and health systems. And I think solutions like this, where stakeholders across the ecosystem partner effectively to adopt technology, not to replace clinicians or hospitals, but to work in a manner that is integrated and bring solutions. I think that's the key and the path forward. So with that, I thank you all and really appreciate this. Over to the colleagues at Elets. Maybe you can take some of these learnings and shape that into a thought leadership article in one of the magazines. But thank you for having us.